And popular medications for off-label weight loss use are still hard to come by. As 6 News anchor Lindsay Lippman found out, one local man with diabetes says navigating the system is very frustrating, but he's doing the best that he can to get the medications that he so desperately needs.
For Charles Rogers, getting his diabetes medication has been no walk in the park.
In most cases, it's on back order. They can't get it, and so we have to contact my doctor and punt.
He was on Trulicity for years, but it was phased out, and Mounjaro phased in. Insurance at first wouldn't cover it.
Insurance companies control your medical care. It's not your doctor, not you. It's the insurance company, what they will approve. And like I said, I went about 3.5, 4 weeks. Well, they would not approve Mounjaro because it was costing quite a bit more than Trulicity.
And then the off-label use of GLP-1 medications like Mounjaro, Ozempic, Zepbound, and more for weight loss caused a shortage that impacted the actual dosage available to Charles.
Switching back and forth is not good, but it's better than doing it out. But they're literally saying, okay, we've got this problem under control. You know, give us 2 or 3 months, we'll have it worked out.
The medications remain on the FDA shortage list, and Dr. Amy Mursiovsky says that's due to several factors.
So there are some studies coming out that this group of medications, like you said, can decrease the incidence of diabetes, also cardiovascular problems, which is huge. And we know that so many people have weight problems, and these drugs are really a miracle for them. But we also have patients who are already diabetic and need them. I think the demand is still going to be pretty high. We know coming out of COVID that there have been a lot of medicines that have been on those shortage lists.
Dr. Mursiovsky says Ozempic is projected to be in very short supply, probably into 2025. Because of cost and availability, online compounding pharmacies have exploded in the marketplace.
Particularly online, that's risky business. That's risky business. And then the compounding pharmacies, I would ask them, is this the same drug? Because there's some other versions out there. Do a little research before you go in and talk to them and make sure it really is the same drug.
And nothing replaces a doctor's advice and care.
If you had trouble getting your medications like I have, just keep plugging with, keep working with your pharmacist, keep working with your doctor. Eventually, it'll happen. It's just, sometimes it takes a while.
In College Station, Lindsay Lippman, 6 News.
And the longest completed trial of the drugs Zepbound and Mounjaro found that 94% reduction in the risk of progression of type 2 diabetes as compared to the placebo. So very effective. It's very promising in the fight against obesity as well. We have more on our online story if you'd like to see an even more detailed report at kcentv.com.